Your heart rate slows, your arteries relax. It's a biological reset, a form of maintenance your body has been performing throughout your entire life. But after the age of 60, that system becomes less reliable. Blood vessels become stiffer, blood pressure regulation becomes less precise. Certain hormonal signals that once protected your heart during the night begin to weaken, and the margin for error becomes much, much smaller. Think of it this way. During the day, your cardiovascular system has backup mechanisms. It can compensate. It can adapt. At night, many of those protective mechanisms are essentially offline. Your body is operating with a skeleton crew. That's what makes the night so different after 60. That's why the hours between midnight and 6 o'clock in the morning carry the highest risk of heart attack and stroke for older adults. Not the afternoon, not the morning rush, the quiet hours, the hours when no one is watching, but your habits are. Now, here's the part that changes everything. What happens during those dangerous hours is largely determined by what you did before going to bed. The meal you ate, the medication you took or didn't take, the temperature in your bedroom, decisions that felt completely routine. That's exactly what we're going to talk about starting right now with the habit that surprises my patients the most. Let me ask you something. What time did you eat dinner last night? And what was on your plate? I ask every patient that question. Surprisingly, many people over 60 tell me they ate dinner around 8 or 9 o'clock at night, sometimes even 10. A full meal, pasta, rice, meat, maybe something fried, followed by sitting on the couch and then going to bed within an hour or two. I understand why it happens. Busy days, family schedules, habits built over a lifetime. But from a cardiac perspective, this routine is quietly harming your heart. A heavy meal late at night is one of the most underestimated stresses your heart can experience. Here's what's happening inside your body. When you eat a large meal, your digestive system demands a tremendous increase in blood flow. Your heart has to pump harder. Your blood pressure rises. Triglycerides, the fats circulating in your bloodstream, rise sharply within 2 to 4 hours after eating. Now, combine that with going to sleep. Your body expects the evening to be a period of winding down, not an all-hands cardiovascular emergency. Instead, your heart is working overtime to digest a large dinner while simultaneously trying to transition into its nighttime recovery mode. Those two demands directly compete with one another. And for someone over 60 with even a moderate degree of arterial stiffness, that conflict can have serious consequences. Studies have consistently shown that eating within 2 to 3 hours before bedtime is associated with elevated nighttime blood pressure, a higher incidence of acid reflux that can mimic or even trigger cardiac symptoms, and an increased risk of cardiovascular events during sleep. The solution is not complicated. Finish your main meal by 6 or 7 in the evening whenever possible. If you need to eat later, keep the meal light, focusing on lean protein and vegetables instead of heavy, fatty foods. Does your dinner schedule resemble what I just described? You might be surprised by how many people answer yes without ever realizing it could affect their heart. Now, I need you to pay very close attention to this next point because this is where some of the most preventable damage occurs. In my clinical experience, if you're over 60 and you take medication for high blood pressure, and statistically more than 60% of people in this age group do, the timing of that medication matters enormously, far more than most physicians take the time to explain. For most people, blood pressure follows a predictable daily rhythm. It rises in the morning, peaks during the afternoon, and falls at night. But a significant number of people over 60, especially those with hypertension, never experience that normal nighttime drop. Their blood pressure remains elevated, or it actually surges during the early morning hours. This condition is known as nocturnal hypertension. Most people have never heard of it, yet it is dangerous in ways that ordinary daytime high blood pressure is not. While you sleep, your arterial walls are not prepared to withstand sudden pressure surges. A spike in blood pressure at 3 o'clock in the morning, affects your arteries very differently than a spike at 3 o'clock in the afternoon. It is more likely to rupture a vulnerable plaque inside a coronary artery, more likely to trigger the formation of a blood clot, more likely to send someone to my operating table. If you take your blood pressure medication only in the morning, it may no longer be working when your body needs it most. If you forget to take it altogether, you may be leaving yourself completely unprotected during the most vulnerable hours of the night. So what should you do? Talk to your doctor specifically about medication timing. Ask whether your blood pressure medication should be taken in the evening instead of the morning. That conversation takes only 2 minutes. It could save your life. There is strong scientific evidence, including findings from the Hygeia chronotherapy trial, suggesting that taking blood pressure medication in the evening can significantly reduce cardiovascular risk during sleep. That is not a minor adjustment. It is a conversation that could potentially save your life. Never assume that timing doesn't matter. In cardiology, timing can make all the difference. Yet most people over 60 have never had this discussion with their doctor. Now I want you to think about someone you know who snores. Maybe it's your spouse. Maybe it's one of your parents. Or maybe it's you. That loud, irregular rumbling sound during the night. Most people dismiss it as an annoyance, something to joke about, something that earns an elbow from a partner in bed. I treat it as a warning sign of heart disease until proven otherwise. After more than 20 years in this field, I mean that literally. Sleep apnea is one of the most underdiagnosed and underestimated conditions I see in patients over 60. It is estimated that more than 30% of older adults have some form of sleep apnea, yet the vast majority have never been diagnosed or treated. They have absolutely no idea what it is doing to their heart every single night. Here's what actually happens during an episode of sleep apnea. You stop breathing for 10 seconds, 40 seconds, sometimes even longer. It may happen dozens of times every hour. Each time it happens, the oxygen level in your blood drops dramatically. Your brain detects a crisis and immediately activates a stress response. Adrenaline is released, cortisol rises, your heart rate suddenly accelerates, your blood pressure spikes. Your heart is essentially jolted awake while the rest of your body remains asleep, night after night, year after year. Now imagine that happening 30, 40, or even 50 times in a single night. What that does to your cardiovascular system is anything but subtle. Sleep apnea is directly associated with a 3-fold increase in the risk of heart attack. That statistic alone should make you stop and think. It is also strongly linked to irregular heart rhythms, including atrial fibrillation, a condition that dramatically increases the risk of stroke. It accelerates the thickening and stiffening of the arterial walls. And because all of this happens while you're asleep, most people have absolutely no idea anything is wrong until a serious cardiac event occurs. The warning signs are not always obvious. Yes, loud snoring is one of them, but there are several others. Watch for waking up with morning headaches, feeling exhausted despite getting a full night's sleep, needing to urinate frequently during the night, waking up with a dry mouth, or waking with a sensation of choking or gasping for air. If any of those symptoms sound familiar, talk to your doctor about having a sleep study. Here's what I tell my patients directly. If you snore heavily, you're over the age of 60, and you have any history of heart disease or stroke, being evaluated for sleep apnea is not optional. It is an essential part of your cardiac care, period. The treatment, most commonly a CPAP device, isn't glamorous. I know that. But the scientific evidence regarding its benefits for heart health is remarkable. Patients who consistently use CPAP therapy experience measurable reductions in blood pressure, lower rates of atrial fibrillation, and significantly reduced cardiovascular risk. One device, one habit, enormous protection. Does anyone in your household snore? Has anyone ever told you that you stop breathing while you're asleep? Think carefully before you move on from this one. Now, let's talk about another habit that is driven by perfectly logical thinking, and that's exactly why it's so easy to overlook. Many people over the age of 60 intentionally reduce how much they drink in the evening. The reason makes complete sense. They want to avoid waking up at 2 o'clock in the morning to use the bathroom. Interrupted sleep is frustrating. Getting out of bed during the night increases the risk of falling. So they stop drinking fluids after dinner, sometimes even after 4 o'clock in the afternoon. I completely understand the reasoning. But from a cardiovascular perspective, going to bed even slightly dehydrated is a significant risk factor, and it's one that almost nobody talks about. When you're dehydrated, your blood becomes more viscous. It becomes thicker. It doesn't flow through your blood vessels as easily. For a younger cardiovascular system, that's usually a manageable inconvenience. For someone over 60 who already has stiffened arteries and plaque buildup, it's an entirely different situation. Thicker blood moves more slowly through arteries that are already narrowed. It is also more likely to form dangerous blood clots. And here's the timing issue that most people never consider. During sleep, your heart rate naturally slows down. Blood circulation also slows. Now, combine that slower circulation with thicker blood in a body that remains motionless for 7 or 8 hours, flowing through arteries that may already be partially blocked. That combination, dehydration, a slower heart rate, reduced movement, and underlying arterial disease is one of the reasons why heart attacks and strokes occur so frequently during the early morning hours. Fortunately, the solution is remarkably simple. Drink 1 full glass of water before going to bed. Not a large amount, just about 8 ounces. That's all you need. It's enough to help prevent your blood from becoming unnecessarily thick while you sleep. Keep another glass of water on your bedside table for when you wake up. If you wake up feeling slightly thirsty at 2 o'clock in the morning, your body is asking for something your heart needs as well. You don't have to choose between getting a good night's sleep and protecting your cardiovascular health. Now, here's another habit that surprises almost every patient when I mention it, because it sounds almost too simple to make a difference. What temperature is your bedroom at night? Most people have never considered that question from the perspective of heart health. They think about comfort. They think about personal preference. But your cardiovascular system actually performs best within a specific temperature range. Outside that range, your heart quietly works much harder than it should. Let's start with a bedroom that's too warm. When the temperature rises above approximately 22 degrees Celsius, or about 72 degrees Fahrenheit, your body has to work continuously throughout the night to release excess heat. Your blood vessels dilate, your heart rate remains elevated, you sweat more, which increases fluid loss and brings us right back to the dehydration problem we just discussed. Perhaps even more importantly, your sleep quality declines. You spend less time in the deep, restorative stages of sleep, the stages during which your heart performs its most important overnight recovery and repair. Now let's look at the opposite extreme. A bedroom that is genuinely too cold, below approximately 16 to 17 degrees Celsius, creates a completely different kind of cardiovascular stress. Cold temperatures cause vasoconstriction. Your blood vessels constrict to preserve your body's core temperature. As they tighten, your blood pressure rises. Your heart has to pump against greater resistance. For someone already living with coronary artery disease or high blood pressure, that increase in nighttime blood pressure is far from insignificant. The optimal bedroom temperature for both quality sleep and cardiovascular protection is between 18 and 22 degrees Celsius, or 65 to 72 degrees Fahrenheit. Within that range, your body remains in what's known as a thermally neutral state. Your blood vessels stay relaxed, your heart rate remains low and steady, your sleep stays deep and restorative. One simple thermostat setting, real protection. Everything I've described so far may sound like a long list of things to worry about, but I want you to look at it differently. When you put all 5 habits together, what you actually have is a practical blueprint for protecting your heart every evening. I call it the Heart's Safe Evening Routine. It fits easily into everyday life without requiring dramatic lifestyle changes. Here's what it looks like. Between 6 and 7 o'clock in the evening, eat your main meal. Choose lean protein, vegetables, and a moderate serving of carbohydrates if you need them. Not an enormous feast, not skipping dinner, just a balanced meal at a reasonable hour. That gives your heart 3 to 4 hours to finish the work of digestion before you go to sleep. Around 7 o'clock, focus on water and your medications. If Dr. William has not specifically discussed the timing of your blood pressure medication with you, let this be your reminder to have that conversation. For many people, taking blood pressure medication in the evening may provide significantly greater protection. Take that discussion seriously. Between 8 and 9 o'clock, enter your wind down period. Take a gentle walk, read a book, have a calm conversation. This is also the time to step away from screens, especially the bright screens of smartphones, which suppress melatonin production and keep your nervous system alert much longer than it should be before bedtime. By 9 o'clock, prepare your bedroom. Adjust the thermostat. Open a window for a few minutes if necessary. Place a glass of water on your bedside table. These tasks take less than 90 seconds, but they matter. By 10 o'clock, you should be in bed. And here's one final detail that costs absolutely nothing. If you snore, or if someone has told you that you stop breathing while you sleep, try sleeping on your side instead of your back. Sleeping on your back can dramatically worsen airway obstruction. Simply changing your sleeping position can significantly reduce episodes of sleep apnea while you arrange for a formal medical evaluation. Dinner by 7 o'clock, water and medications around 7, a calm evening until 9, your bedroom prepared by 9, in bed by 10, sleeping on your side. The question is never whether this routine works. The scientific evidence is clear that it does. The real question is whether you will actually follow it, and that's a question only you can answer. Now I'd like to speak to you honestly for a moment, not as a content creator, but as a surgeon. I have stood beside an operating table at 3 o'clock in the morning, holding a heart that had stopped because a blood clot formed overnight inside a narrowed coronary artery. I've spoken with families sitting in hospital waiting rooms at dawn, families who had no idea anything was wrong when they wished their loved one good night just a few hours earlier. I have read autopsy reports on people who had been planning their grandchildren's birthday parties only a week before. And in case after case, the contributing factors were not mysterious. They were a late dinner, a missed blood pressure pill, a bedroom that was too warm, a body that quietly became dehydrated, an airway that had been collapsing silently for years while everyone assumed the snoring was harmless. These are not rare or exotic risk factors. They are simply the background noise of millions of ordinary evenings. But that background noise, repeated night after night, year after year, can eventually become the heart attack that no one saw coming because no one knew where to look. Here's the greatest lesson more than 20 years in the operating room has taught me. Most of the hearts I've had to repair did not fail because of bad luck. They failed because of missing information. Information the patient simply never received. Now you have that information. The question is what you'll do with it tonight, not next week, not after your next medical appointment, tonight. So let's bring everything together. 5 habits, 5 solutions. I want you to leave this video with a clear action plan, not simply a vague sense of concern. First, finish your main meal by 6 or 7 o'clock in the evening. No extreme diet, just a sensible dinner at a sensible hour. Second, speak with your doctor about the timing of your blood pressure medication. Specifically ask whether taking it in the evening would be appropriate for you. That single conversation could become the most important medical discussion you have this year. Third, if you snore, wake up feeling exhausted, or if anyone has ever told you that you stop breathing while sleeping, get evaluated for sleep apnea. Once you're over 60, this isn't optional. It's an essential part of protecting your heart. Fourth, drink 1 glass of water before going to bed. Keep another glass on your bedside table. Don't allow your blood to become thicker overnight simply because you wanted to avoid getting up to use the bathroom. Fifth, keep your bedroom temperature between 18 and 22 degrees Celsius or 65 to 72 degrees Fahrenheit. That one simple adjustment helps protect your blood vessels and costs absolutely nothing. Now I'd like to ask you something directly, and I genuinely appreciate your answer in the comments below. Which of these 5 habits do you recognize in yourself? I have a feeling at least 2 or 3 of them probably sound familiar, and if they do, you're certainly not alone. Most of my patients recognize themselves somewhere on this list. The difference is that now you know what to do about it. If you found this video helpful, please share it. There is almost certainly someone in your life, a spouse, a brother or sister, a close friend, or another loved one over the age of 60 who has never connected their nightly routine with the health of their heart. Send this video to them. Take care of your heart. It has been working faithfully for you every minute of every day and every night throughout your entire life. Give it the conditions it needs to keep working for many more years. One final thought. Everything I've shared